Hey everybody, this is Dr. Zachary Ward at Life and Alignment Chiropractic here in Auburn Hills, Michigan. I am an upper cervical chiropractor using upper cervical chiropractic procedures, and this video is about vertigo, which is a confusing and disturbing topic for a lot of people, especially those who are suffering with it, who haven't found good answers. So I'm hoping to uncomplicate vertigo for you by perhaps giving you some information you haven't heard before, even necessarily from your ENT and other doctors, and it's called vertigo, the disturbance of two secret senses. And before we get started, I want to send a shout out to Jen, who works at Big Water Technologies, which is a telecommunications company here in Southeast Michigan. And she asked me a question on Facebook, which kind of allowed me to think this through, to put this information together. And I did so using kind of a way of teaching the sensory system that is presented in a book called Sensory Processing 101, which I think is a great book. I think everybody should check it out. Sensory Processing 101, especially Dana and the folks at the Inspired Treehouse, which is two occupational therapists and PT, physical therapist bloggers. They kind of present information on the sensory system in a very simple and clean way, and I'm borrowing some of that way that they do that here to explain this. So vertigo is the disturbance of what we call two secret senses. And we are pretty familiar with the five senses that we have, which is a sense of smell, sense of taste, sense of touch or feel, some people say, your vision or your ability to see, and then your hearing. And then you have two other senses, one called equilibrium, which is kind of how you relate to the ground where you are in reference to gravity in the horizon. And then the second one that is secret is called proprioception, which is your ability to interpret where you are in space and time internally. So like where your pinky is versus where your pinky toe is, that is proprioception. That's basically the simple way of explaining it. And balance is a communication and a coordination between your equilibrium system and your proprioception. So it's knowing where you are and knowing where the ground is. And if you're successful at that, you've got balance, right? So what happens with vertigo is we lose track of our balance because we don't know where we are or we don't know where the ground is. And that confuses the brain, and then we have the symptoms of vertigo. So vertigo can be caused by a problem equilibrium, and we're all very familiar with this if we've ever had vertigo, because that's what primarily medicine pays attention to. It can also be caused by a problem in the proprioceptive system or your proprioception. And we're going to go ahead and talk about both of those. So vertigo is a problem in the equilibrium we know about because of maybe inflammation in the inner ear, maybe because of an infection, or some people say you might have ear crystals that are kind of floating around in the inside of the inner ear. They call that canalithiasis. It's a big long word, but that's what that means. And this problem in the inner ear sends disturbing information to something called the eighth cranial nerve. So you have these 12 nerves that kind of come off the brain, and the eighth cranial nerve is involved in coordinating your sense of balance. And so either the infection or the water in the inner ear or maybe the ear crystals, those confuse the brain. And that's the problem in the equilibrium system, which we know about. Well, there's another system that can get confused, as we said, the proprioceptive system. In which case, if this is what's happening, it's not necessarily an infection or an inflammation in the inner ear, or maybe even ear crystals, but it could be a problem in the proprioception that creates the confusion in the brain. And a major source of that is actually joint irritation or joint misalignment. And in our chiropractic world, we call that the chiropractic subluxation, or the misalignment complex. And so what this might look like is at the top of the neck you have a lot of proprioceptors, which are like your nerve system sends out all these little feelers, and the proprioceptors are one of those systems of feelers, and they tell your brain where your joints are. Because think about it, if your joint positioning, if it doesn't know where it is, that could be a cause for injury and all kinds of problems. So at the top of the neck, we have a very small area that's very loaded with these joint position sensors called proprioceptors. Well, what can happen is an irritation at that level will sometimes overstimulate or understimulate some of these proprioceptors, and that sends bad information into the brain, particularly the brainstem, particularly through a relay that we think is involved in the trigeminal nerve root nucleus. Okay, well, you don't necessarily have to pay attention to that. Just know that the signal going up is somehow confusing the brain, and it's confusing the brain in the balance center. Okay? complicating factor in this that we also have to pay attention to, at least from my perspective, is the facial structure and the vision. So sometimes misalignment in the actual facial structure will change the way the head is positioned. So you see people that kind of have their head over here like this. Well, that could be from the misalignment, yes, but it also can be involved in terms of like how the facial structures come together and how it's developed over time, or how you've had an injury that's affected eye alignment and muscle coordination of the eyes. And so this is a complicating factor, and so it's something that you need to pay attention to, because this is also part of the proprioceptive system that kind of feeds back into that eighth cranial nerve. So eye alignment problem can affect your sense of balance. So can a joint alignment problems affect your sense of balance. So what do you have to do next if you've got vertigo and you can't get it solved? Well, hopefully you've already looked into that ear inflammation, that equilibrium route where they're looking at what's going on inside the ear, and maybe you've gotten that kind of crossed off your list. Okay, maybe I've had an inner ear infection, maybe I really do have those ear crystals, who knows? We've got that crossed off the list. Next, you need to look into the possibility of a brain problem, and this is probably what will be recommended to you if you're not responding to whatever an ENT recommends, or some exercises related to the ear crystals. I'll come back to the ear crystals in a minute. So this order isn't necessarily the order that I'm necessarily recommending. It's just the order that a lot of people end up going through. If it doesn't seem like there's a problem with the brain, so you're getting like an MRI and it's coming out clean or something like that, then people will stumble across, oftentimes online. Unfortunately, they don't always get the referral from a primary care physician or an ENT. But they might run across the idea of neck alignment or upper cervical alignment may be affecting their sense of balance. And so neck alignment or eye alignment in that proprioceptive system needs to be investigated. In terms of eye alignment, there's a lot of different theories out there about how this works. There's a couple different groups of basically ophthalmologists or doctors of optometry that are looking at different eye alignment using different kinds of prisms and trying to align the eyes that way. And then in terms of neck alignment, there are different kinds of chiropractors, and there's a group called the upper cervical chiropractor, which spends a lot of time and energy trying to rebalance that top of that neck. And that would be the place where I would look into if I had a chronic vertigo issue. Extra points to you if you realize that I misspelled a diagnosis. All right, where you can go next is you can go to liachiro.com if you're not already there, and you can take a look at my website. There are a few cases of vertigo that I write about or talk about. You could do researches on upper cervical procedures. I would encourage you to look up something called cranio-cervical syndrome. There's a whole mess of symptoms, including vertigo and other symptoms, that are involved in cranio-cervical syndrome. This is kind of like the medical name for what we talk about is happening as upper cervical chiropractors. If you want to get in touch with me directly, you can go to liachiro.com, go to the contact page, shoot me an email that way, or you can call me, 248-598-4002, and ask me a question that way. If no one in the office is available to answer your call, leave a message, and I'll try to get back to you. Thank you so much for listening. I hope this was helpful. Do me a favor, if you don't have vertigo but you know someone who does, please share this video with them. If you're on YouTube, please like this video. If you're on YouTube, go ahead and leave a comment. If you're finding this via Twitter, please like and retweet. If you're finding this on Facebook, please go ahead and like and share and get this good information out there, because there's a lot of people with vertigo that need to have their proprioceptive or their joint alignment system evaluated for this issue, and they just simply don't know about it. Take care.